I'm Dr. Bao, practicing endocrinologist. Today, we are going to talk about the most dangerous side effect of taking metformin, lactic acidosis, and how to prevent it. Luckily, lactic acidosis is very rare. Based on multiple studies, the incidence is around 4 cases in 100,000 patient years. What is lactic acidosis anyway? Lactic acidosis is the accumulation of too high lactic acid in blood, which causes too much acid and causes organ failure. How does our body produce lactic acid? Lactic acid is a normal product of glycolysis. Glycolysis is the process of breakdown of sugar to provide energy for our body quickly. For example, when you are involving in a very strenuous exercise, your muscle needs a lot of energy and need them quickly. At this time, your muscle produces a lot of lactic acid. The production of lactic acid increases when our body suddenly needs a lot of energy, or our body does not have energy, oxygen, or tissue organ does not have enough blood supply. Let us also quickly review how does metformin work. If you have not watched my previous video, how does metformin work? Please go back to watch it. Here, let us review. The exact of mechanism how metformin works is still under intensive investigation. Now, most scientists agree that metformin increases the production of lactic acid in the liver, gastrointestine, kidney, and other tissues. The use of lactic acid for making new sugar is also reduced in metformin-treated patients. As a result and summary, metformin increases the production of lactic acid and reduces the usage of lactic acid. 2 organs are very important in getting rid of lactic acid. One is the liver, which converts lactic acid back to sugar, called gluconeogenesis. The other is the kidney, which excretes lactic acid and also converts it into sugar. Again, the gluconeogenesis. Liver is important, but the kidney is more or equally important, since metformin is not metabolized in the body, but is excreted from the kidney unchanged. If the following situation occurs, I might recommend to hold or stop metformin. Again, for your specific situation, you need to talk to your health provider, and you might need to go to the ER. The severe high sugar and low sugar can be deadly. Situation 1. If you have severe nausea, especially you have hard time in keeping water down. Situation 2. If you have vomiting for any reason. Situation 3. Moderate to severe diarrhea from any reason. Situation 4. Acute or chronic abdominal pain. Situation 5. Shortness of breath from any reason, especially acute or worsening. Situation 6. Suspect developing yellow skin or yellow urine, usually indicating liver failure or dysfunction. Situation 7. Chest pain, especially if you suspect that you might have angina or heart attack. Situation 8. You have reduced urine output. Situation 9. If you develop fever, especially greater than 104 degrees Fahrenheit. Situation 10. If you are scheduled to have a IV contrasted CT or cardiac procedure. Situation 11. If you have to be fasting more than 8 hours, you can consider to take the last dose before fasting with the meal, but not to take afterwards. You might have to be fasting for outpatient surgery or colonoscopy. You might think, take your last time you were fasting. Nothing happened. This is true. Most time, if you take it, nothing happens, but you want to be precautious. Situation 12. If you are drunk, not to take it. Alcohol can cause sugar up and down. Alcohol can cause vomiting. Alcohol can also inhibit the sugar metabolism and may reduce the liver to get rid of acid and might increase the production of lactic acid. Situation 13. Acetaminophen can also damage the liver, especially if you consume alcohol. Never drink and take acetaminophen together. Never take acetaminophen over 4 grams. If you think you might have taken over 4 grams in 24 hours, inform your doctor and not to take metformin. Situation 14. If you are diagnosed acute or chronic hepatitis for any causes. Situation 15. If you are diagnosed cancer, which needs chemotherapy. Now we have lots of different cancers which do not need chemotherapy. You might be okay to continue to take metformin, and you don't need to stop it. Situation 16. If you're going to run marathon, you should consider not to take the day before. Marathon can produce a lot of lactic acid and also cause dehydration. Situation 17. If you have started medications like topiramate, which can cause acidosis, you need to be cautious. Again, metformin is a safe medication. I let my patients take both if they have perfect kidney and liver function. If you want to learn more information like this and would like to have a book in hand, please check out my books on Amazon.com.